Hello everyone, today I am going to take your lecture on pharmacological behavior management. The contents are introduction, definition, sedation continuum, classification, indication, contraindication, patient evaluation, monitoring devices, level of sedation, route of sedative drugs, drugs used for sedation, nitrous oxide, oxygen inhalation. So, the pharmacological management is a broad term used to describe the use of drugs to manage the behavior of uncooperative pediatric patient undergoing the dental treatment. So, the pharmacological management is further divided into two subcategories. First is the conscious sedation, and second is the general anesthesia. Now the definition. What is conscious sedation? It is a minimally depressed level of a consciousness that retains the patient's ability to maintain a airway independently and respond appropriately to the physical stimulation and the verbal command. So the American Society of Anesthesiologists revised and updated its guidelines to include a definition of continuum of sedation that occurs when sedative and analgesic medications are administered. So conscious sedation, according to the ASA, it can be it is from the lightest to the deepest sedation level. So a person given drugs can be in the state of minimal, or they can be in the state of moderate, or they can go in the state of deep sedation. So this is the sedation continuum. So the minimal is anxiolysis, where the anxiety and fear of the patient is reduced, in which the drugs induced, it is a drug induced states during which patient respond normally to the verbal command. Cognitive and coordination may be impaired. Ventilatory and cardiovascular function are unaffected. Moderate is a conscious sedation in which a patient responds to the drugs purposefully to verbal command or tactile stimulation. Cognitive and coordination is impaired. Ventilatory and cardiovascular functions are adequate. Deep sedation, drug-induced depression of the consciousness, which patients cannot be easily aroused but respond purposefully after repeated verbal or painful stimulation. Ability to independently maintain the ventilatory functions and may be impaired. This is the classification according to the AAPD 2015. So they have divided into basic behavior guidance and advanced behavior guidance. Basic behavior guidance, that is a communication and communicative guidance, which includes the pre-visitory images, direct observation, tell, show, do, ask, tell, ask, voice control, distraction, memory reconstructions, and so on. They have also included nitrous oxide oxygen inhalation in the basic behavior guidance technique. Advanced behavior guidance technique includes protective stabilization like pappus board, headrest, and restraints are there included in the protective stabilization. Sedation with the different drugs like midazolam, ketamine, dexmedetomidine, fentanyl, and general anesthesia. Again, the classification was revised by AAPD in 2020, and they have, apart from the basic behavior guidance and advanced behavior technique, they have additional behavior guidance technique for the anxious patient with children, special healthcare children needs, and it includes the sensory adapted dental environment, animal assisted therapy, and picture exchange communication system, in which nitrous oxide and oxygen inhalation has been included. So in this, if the patient is in mild autistic or mild cerebral palsy patient, can be managed with the nitrous oxide or oxygen inhalation. In the case where the patient is moderate or patient is severe, they are best suited for the general anesthesia cases. Now, see, in the indications of sedations are patient are who cannot be managed by the basic behavior guidance procedure, dental fear and anxiety, odontophobia, lack of psychological and emotional maturity, mentally retarded patient or intellectual disability, patient requiring emergency or extensive treatment, patient not able to cooperate due to the lack of understanding, and contraindications, patient beyond ASA status 1 or 2, and a severely uncooperative patient unwilling and unaccompanied, prolonged surgery, multiple appointment required, and inadequate process. So for patient evaluation should be done before any sedation. So we have to see the ASA status and behavior of the patient and the tonsil. So this is the ASA status. ASA 1 is best suitable for the sedation, and ASA 2 also. Beyond ASA 1 and 2, we do not do the procedure in the sedation. Frankel's behavior rating, we will definitely negative patients are suitable for the GA cases. Rating 2 negative and positive are most suitable for the nitrous oxide oxygen or sedation. These are the classifications. Stage 1, if the obstruction is less than 25, they are suitable and good cases for sedation. Stage 2 is if obstruction is more than 25 or less than 50, they are also good category. Stage 3 and stage 4 is best suitable for the GA or GA cases, not for sedation. This is nil per oral status, ASA fasting guidelines. Clear fluid should be 2 hours, milk, human infant formula 4 to 6 hours, light food 6 hours, and heavy food 8 hours. SOCME for the preparation for the sedation. So it is commonly known as SOCME. So as for the appropriate size and catheter suction catheters and functioning suction apparatus should be available. Adequate oxygen should, O for oxygen supply should be adequate. A for airway size appropriate airway equipment should be available in the OT theater. And B for all basic drugs and all the antagonist and reversible agents should be or emergency drugs should be available. M for monitors all the pulse oximeter, heart rate and capnography probe should be available for the monitoring the uh, these parameters. And E for a special equipment or drug for the particular cases where in the case patient is losing defibrillator is must be there in the operation theater. These are monitoring protocol. First of all, we will check the vital signs. Then drug and dose and timing should be noted, and have the state of consciousness and response to the stimulation should be noted. And ideal volume of carbon dioxide monitoring should be done. Capnography and bispectral monitoring should be done, and partial oxygen and heart rate monitoring should be done. These are the monitoring device like pulse oximeter, capnography, bispectral monitoring, and precordial stethoscope. This is not a non-precordial stethoscopes are not cordial. This is used to measure or this is used to listen the tracheal. Cordial means tracheal sound whether patient is breathing or not.